Hi, everyone. My name is Richard Inslee, and today I'll be doing the condition presentation for attention deficit hyperactivity disorder, better known as ADHD, and I'll be focusing on the diagnostic criteria for the DSM-5, which all needs to be met in order for this disorder to be diagnosed. Starting with criteria A persistent pattern of inattention and/or hyperactivity impulsivity that interferes with functioning or development as characterized by subset 1 and/or subset 2. Subset 1 focuses on inattention. 6 or more of the following symptoms have persisted for at least 6 months to a degree that is inconsistent with developmental level and that negatively impacts directly on social and academic/occupational activities. A, often fails to give close attention to details or makes careless mistakes in schoolwork, at work, or during other activities. For example, overlooks or misses details, work is inaccurate. B, often has difficulty sustaining attention in tasks or play activities. For example, has difficulty remaining focused during lectures, conversations, or lengthy reading. C, often does not seem to listen when spoken to directly. For example, mind seems elsewhere, even in the absence of any obvious distraction. D, often does not follow through on instructions and fails to finish schoolwork, chores, or duties in the workplace. For example, starts tasks but quickly loses focus and is easily sidetracked. E, often has difficulty organizing tasks and activities. For example, difficulty managing sequential tasks, difficulty keeping materials and belongings in order, messy, disorganized work, has poor time management, fails to meet deadlines. F, often avoids, dislikes, or is reluctant to engage in tasks that require sustained mental effort. For example, schoolwork or homework. For older adolescents and adults, preparing reports, completing forms, reviewing lengthy papers. G, often loses things necessary for tasks or activities. For example, school materials, pencils, books, tools, wallets, keys, paperwork, eyeglasses, mobile telephones. H, is often easily distracted by extraneous stimuli. For older adolescents and adults may include unrelated thoughts. I, is often forgetful in daily activities. For example, doing chores, running errands. For older adolescents and adults, returning phone calls, paying bills, keeping appointments. Subset 2 focuses on hyperactivity and impulsivity. 6 or more of the following symptoms have persisted for at least 6 months to a degree that is inconsistent with developmental level and that negatively impacts directly on social and academic/occupational activities. A, often fidgets with or taps hands or feet or squirms in seat. B, often leaves seat in situations where remaining seated is expected. For example, leaves his or her place in the classroom, in the office or other workplace, or in other situations that require remaining in place. C, often runs about or climbs in situations where it is inappropriate. Note, in adolescents or adults may be limited to feeling restless. D, often unable to play or engage in leisure activities quietly. E, is often on the go, acting as if driven by a motor. For example, is unable to be or uncomfortable being still for an extended time, as in restaurants, meetings. May be experienced by others as being restless or difficult to keep up with. F, often talks excessively. G, often blurts out an answer before a question has been completed. For example, completes people's sentences, cannot wait for turn in conversation. H, often has difficulty waiting his or her turn. Example, while waiting in line. I, often interrupts or intrudes on others. For example, butts into conversations, games, or activities. May start using other people's things without asking or receiving permission. For adolescents and adults, may intrude into or take over what others are doing. Criteria B, Several inattentive or hyperactive impulsive symptoms were present prior to age 12 years. C, several inattentive or hyperactive impulsive symptoms are present in 2 or more settings. For example, at home, school, or work, with friends or relatives in other activities. Criteria D, there is clear evidence that the symptoms interfere with or reduce the quality of social, academic, or occupational functioning. Criteria E, the symptoms do not occur exclusively during the course of schizophrenia or another psychotic disorder and are not better explained by another mental disorder. For example, mood disorder, anxiety disorder, dissociative disorder, personality disorder, substance intoxication, or withdrawal. The last thing I want to discuss with you are some cautions regarding the assessment and diagnosis of ADHD. Here are some notes, and I do believe they're important for an accurate diagnosis. Initial onset per the DSM-5 is as late as age 12. Many clinicians believe that for this to be a reliable diagnosis, symptoms need to be present and are present prior to the age or up to the age of 7. That children are usually born with this disorder, so you'll see symptoms a lot earlier in their lives. Be careful when diagnosing in adults. A lot of adults are taking advantage of the medication, typically amphetamines, to use recreationally to enhance the way they play sports, to enhance their work performance, to enhance their school performance, and some are even taking them and selling these drugs on the streets. As we can see from the bullet point above, per the DSM-5, onset as late as age 12, and even other clinicians say that should be much lower. So obviously we can see the difficulty when it comes to the diagnostic assessment in adults. Differences in developmental progression. Every child has a different rate that they develop through their stages of life. I don't think that we should diagnose someone, who's, hyperactive in school and distracted, with an idea in our heads that they should be past that, or they should be where their peers are. I mean, I think a lot more goes into it, considering all children are different. They have different temperaments. So I think we have to be really careful when we're giving someone this diagnosis, and take all factors into account. Normal versus abnormal. Again, the diagnosis of any mental disorder is very subjective. So the determinant is always normal. What's normal behavior? What are normal symptoms versus abnormal? Again, we just have to pay close attention to our own biases, society's biases on what's normal versus abnormal. I think that abnormal behavior, we really have to look at abnormal behavior as something that it's on an individual level, something that's greatly impacting the child's or the adult's life, and they're experiencing suffering because of it in their lives. Considering that we all have some hyperactivity, impulsivity, we all get distracted at points. I just think that has to be to a whole nother level when it comes to diagnosing this disorder. And the final thing are my references, and I thank you all for letting me share.